Look at me. I want you to listen to me, and I want you to listen to me right now. If you are retired, or if you are waking up every single day counting down the months until you finally punch that clock for the last time, we need to have a serious, unfiltered reality check about your healthcare. Because right now, there is a quiet, devastating storm brewing in the world of Medicare, and if you are not paying attention, it is going to blow a massive hole right through your retirement nest egg. I am talking about Medicare Advantage plans. You know exactly what they are. You cannot turn on your television without being bombarded by commercials featuring smiling, silver-haired actors promising you the world. They tell you it costs absolutely nothing. $0 premiums. Free dental. Free vision. They make it sound like the greatest financial gift you have ever been handed. But I have always told you, if something sounds too good to be true, what is it? It is too good to be true. Right now, across this country, a massive shift is happening. Major hospitals, legendary health systems like the Mayo Clinic and Mount Sinai, and thousands of top-tier doctors are flat-out dropping Medicare Advantage plans. They are walking away from the negotiating table and telling these private insurance companies, no more. We are out. And guess who is caught in the crossfire? You are. Imagine waking up, needing a critical surgery or going in for your routine oncology checkup, only to be told at the front desk, I am so sorry, but we no longer accept your insurance. Your doctor is no longer in your network. Can you feel the panic that would cause? The sheer, unadulterated fear of being stranded when you are at your most vulnerable? This isn't a hypothetical scenario. It is happening to millions of seniors right now. So, you have to ask yourself the big question, why? Why are doctors and premier medical institutions suddenly turning their backs on these multi-billion-dollar insurance giants? It all comes down to two things that drive the corporate world: money and control. When you sign up for an original, traditional Medicare plan run by the federal government, you can see any doctor anywhere in the United States, as long as they accept Medicare. Period. There are no gatekeepers. But when you choose a Medicare Advantage plan, you are choosing to hand over your government benefit to a private, for-profit insurance corporation. And how do private insurance companies make money? They make money by collecting premiums from the government and paying out as little as humanly possible for your medical care. Hospitals and doctors are dropping these plans because they are sick and tired of playing what they call the delay, deny, and don't pay game. Doctors are spending hours upon hours fighting corporate algorithms just to get approval for an MRI, a cardiac scan, or a vital rehabilitation stay for their patients. It is called prior authorization, and it is a massive bureaucratic wall. The insurance companies use these tactics to control costs, which protects their bottom line. But for the doctors, it means an overwhelming administrative burden. And for the hospitals, it means losing millions of dollars on delayed reimbursements or outright denials for care they already provided. They have reached a breaking point, and they are choosing financial sustainability over staying in these restrictive networks. At the exact same time, the federal government has started tightening the belt on these private insurers. New regulations are capping out-of-pocket prescription costs, and rules are shifting the financial burden back onto the insurance companies. Because the insurers are seeing their profit margins squeezed, they are aggressively dropping unprofitable plans, pulling out of entire counties, and tightening their provider networks even further. This brings us to the core fear that is keeping so many of you up at night. The fear of the unknown. The fear that the coverage you paid into your entire working life won't actually be there when your health takes a turn for the worse. You worry that you are going to be forced to choose between changing the doctor who has kept you alive for 10 years, or paying tens of thousands of dollars out of your own pocket to keep seeing them. And you have every right to be afraid. Because your health is your wealth. You can have millions of dollars saved in your 401k, but if you suffer a catastrophic medical event and your private insurance plan denies coverage, or forces you to go to a subpar facility because your preferred hospital went out of network, your financial security can evaporate in the blink of an eye. So, what is the answer to the ultimate question? What must you do right now to protect yourself? First, you must understand that you cannot afford to be passive. Gone are the days when you could just pick a health plan, put it on autopilot, and assume everything would be fine year after year. Your very first actionable takeaway is this: you need to audit your medical network immediately. Do not wait for the annual enrollment period in the fall. Call your primary care physician's billing department. Call your specialists. Call the local hospital system that you trust. Ask them directly, are there any Medicare Advantage plans you are planning to drop next year? Get the answer straight from the provider's mouth, because the insurance companies will often delay updating their directory maps until it is too late for you to switch. Second, you need to understand your escape hatch. If you receive a notice of non-renewal in September or October stating that your plan is being discontinued or your doctor is leaving, do not panic. You are legally entitled to a special enrollment period. You have a window of time to make a change. But here is the critical pivot point where so many people make a catastrophic mistake. When your Medicare Advantage plan lets you down, your instinct might be to just look for another Medicare Advantage plan. I want you to step back and look at the broader horizon. Be proactive. Check your network, demand answers from your providers, and look past the marketing gimmicks. Take control of your healthcare destiny today, because nobody else is going to do it for you.